Hello, good people. Today I'm presenting Module 4, which is about medication. We need to understand what's safe, what works, and what to avoid. Welcome back to the Pain Management course by Dr. BA Mabaso Incorporated. So today is one of the most misunderstood topics in healthcare, pain medication. Many people take painkillers incorrectly, too often, too much, or in dangerous combinations. So this module will help you understand which medications are safe, what each one does, when to use them, what to avoid, and how to manage pain without harming your health. Safe and effective medication. This doctor shows a tablet and a stage in the medical consultation. So he has done the diagnosis, the examination, and the scans, and is ready to move forward to prescribe medication. This doctor is explaining the medication to her patient. Very important that the patient must ask all the questions and clarities at this stage to avoid mistakes. There are 4 main types of pain medication. One is mild pain relievers, including Panado, paracetamol, for mild headaches, back pain, and fever. Then number 2 is NSAIDs, anti-inflammatory drugs. They include ibuprofen, naproxen, diclofenac. They are used for arthritis, injuries, and swelling. Third category is nerve pain medication, including amitriptyline, gabapentin, and pregabalin. For sciatica, diabetic neuropathy, tingling, burning pain. And the last category is strong painkillers, the opioids. They include tramadol and codeine. They are injections in doctors' offices. Pethidine, morphine. They are for short-term use only, high risk of addiction, misuse. So, 4 categories: mild, analgesics, anti-inflammatory, nerve pain, and opioids. Analgesics, Panado, NSAIDs, Brufen. Nerve pains, amitriptyline, and opioids, Tramadol. Now, let's start with Panado, the most commonly used one. It's one of the safest pain medications if used correctly. It works for headaches, mild pain, fever, general body pain, but you must not exceed 4 grams per day. Too much can severely damage your liver. So, summary, Panado is safe and effective. Don't exceed 4,000 milligrams daily. The doctor here gives us a warning. Maximum is 4 grams per day in Panado use. Same again here, danger sign, 4 grams per day. And this young doctor shows us the dosages. For adults, when you're 12 years and older, it's 1 gram, 6 hourly. So that's 4 grams per day. For younger children, 500 milligrams, 6 hourly. And for kids, 240 milligrams, usually in a syrup. The damage happens in the liver if you overdose. Some patients have to be admitted in hospital when they have parasuicide. They have taken an overdose of Panado tablets. That can be toxic to the liver, dangerous, can kill you. Right, NSAIDs, are excellent for inflammation-based pain, such as arthritis, muscle injuries, period pain, sprains, and swelling. They must be used carefully too. They cause stomach ulcers, kidney injury, heart problems, and increased blood pressure. So people with kidney problems, ulcers, or heart conditions must use NSAIDs with caution and get advice from the doctor. NSAIDs for inflammation. Problem happens in the liver when there is overdosage in most medications. So the old man with terrible pain in the knee will benefit from the NSAIDs. The young man with the knee problem will also benefit from NSAID. Warning again, NSAIDs cause ulcers, kidney damage, heart damage. They must be taken with food. Let's move to nerve pain medication. So nerve pain is different from normal pain. So Panado and ibuprofen often don't help. That's why we use nerve pain medication, including amitriptyline, gabapentin, pregabalin. They are especially effective for diabetic neuropathy, sciatica, tingling or burning, and post-shingles pain, and nerve compression. They cause sleepiness, dizziness, and dry mouth. So, nerve pain, burning, tingling, electric pain needs special medication. The old man needs a nerve pain medication. The young man with sciatica. Nerve pain problem. This slide shows the effect of gabapentin in calming nerves. The last group is opioids, including tramadol, codeine, pethidine, morphine injections. They are powerful painkillers, but they come with serious risks. We reserve them for severe acute pain, after surgery pain, short-term flare-ups, but they should never be used long-term for chronic pain, because they can cause tolerance, dependence, addiction, withdrawal symptoms, dangerous interaction with alcohol and sedatives. So, summary: opioids for short-term use only. He's holding a pill of tramadol with a warning. Again, he's warning us. He's issuing the medication with a warning, worried sign. They help with pain, but they can cause addiction and dependence. So tramadol causes addiction, dizziness, and overdose. Next section talks about safe combination and dangerous mixes of medications. Panado and ibuprofen, safe. Panado, Diclofenac, safe. Panado, nerve pain meds, safe. NSAID plus muscle relaxant, safe. 2. NSAIDs, kidney damage. Tramadol and alcohol, sedative, dangerous. Tramadol and sleeping pills, same as alcohol and tramadol. Multiple NSAIDs at the same time, ulcers, kidney damage, heart problems. Never mix two NSAIDs. So, Panado, no addiction, no dizziness. Tramadol, dizziness, and overdose. Don't mix two NSAIDs. So how do you take pain medication safely? You start with the lowest dose that works. Don't mix similar drugs. Eat before taking NSAIDs. Avoid alcohol in taking strong painkillers. Track your symptoms. Don't take tablets blindly. We take pills for pain. Talk to your doctor if you need medication for more than 10 days. Are there any safe medication rules? Yes. One is to use pill organizers. Prevents forgetting and overdosages. Know the rules. Don't use Ibuprofen and Diclofenac same time. Now you know different types, when to use each, common risk, and safe combinations. This is a pill diary. So the medication plan is complete now. In the next module, we'll focus on the most powerful tools for long-term relief: exercise, therapy, and movement. For now, you can download the weekly medication planner and the safe pain medication rules guide. Thank you for watching. We'll see you in module 5.